bit about some resident data as well as some data with other healthcare professionals. But seeing that it's the beginning of January, you may potentially be having some students or residents that are rotating with you, and I'm super excited that we do have students with us, a whole bunch of them with us today. It's a really important topic, and it's garnering a lot more attention, especially as some of the suicide rates increase. So I thought it was helpful. I got different slides up. Hold on just a second. Jamie's testing me. There we go. So our objectives for today, we're going to define what burnout means. We're going to list the symptoms of burnout in health profession students, residents, or in healthcare professionals themselves. We'll take a look at the incidence, specifically in students, a little bit with residents, a little bit with the healthcare professionals, and then we'll talk about some steps to assist these individuals, including ourselves, to deal with the burnout. So let's start at the beginning. What is burnout? So from the dictionary, burnout is defined as fatigue, frustration, or apathy resulting from prolonged stress, overwork, or intense activity. I think a lot of individuals generally have a concept of what burnout is, but it's really difficult to put into words what that actually means. One of the more formalized definitions is a state of physical and mental exhaustion related to caregiving activities or to work. So burnout was originally identified in the helping professions, so healthcare professions as well as educational professions with teaching. It then moved into the business community, and there was a relatively intense look at burnout related to productivity. It's now kind of trickled down and has a much more holistic approach, but it's interesting based on which lens you're looking at it through. There are some very different outcomes that individuals are most interested in. Even though there may be different outcomes, there are 3 dimensions of burnout that are consistently utilized. So the first is emotional exhaustion. The second is depersonalization. This is also sometimes referred to as cynicism. And then reduced personal accomplishment, which also may be referred to as professional efficacy. So Maslow has the most well-defined definition of burnout, and she defines it as the psychological syndrome emerging as a prolonged response to chronic interpersonal stresses, specifically on the job, but it may be in a caregiver role, even if it's not a formal job that you're paid for. So we're going to focus on each of these dimensions individually, but before we do that, so what? So why do we have to worry about burnout? There are some really significant consequences that can result from healthcare professional burnout. So it's been documented that increased levels of burnout have been associated with adverse effects on patient safety, including medical errors, which could be problematic, especially in some of the healthcare institutions like our hospital health systems, where they have to monitor all of these and report them back. This has been associated with an increased risk for alcohol or drug abuse, the drug abuse being things like opiates, benzos, sedatives, as well as stimulants, so to try to overcome some of the potential fatigue that could happen. There's an unclear relationship between burnout and depression. In some of the literature suggests that burnout and depression are intricately linked. As we talk about what the symptoms are, there is definitely overlap where they would look similar, but it sounds like, at least in the more recent literature, depression and burnout coincide, but they're not mutually exclusive. So it's not that burnout is depression or depression is burnout, but they definitely fuel each other. There is a negative impact on healthcare provider burnout and patient satisfaction. So patients who frequent healthcare systems that have a higher level of provider burnout or provider turnover do consistently have lower patient satisfaction. Interestingly, there is a significant relationship with burnout and hospitalization. So when they looked at individuals in the workforce, so it was mainly in the helping professions, so teachers, educators, as well as healthcare providers, those that were screened for burnout and essentially screened positive for having burnout, they had a significantly increased risk for being hospitalized within the next 3 years, mainly for cardiovascular conditions, but also for mental health conditions. So that seemed to be one of the strongest correlations. There's self-reported suboptimal patient care where individuals don't feel like they're doing as much as they would like to, or as well as they should be for their patients. And one of the big risks, especially related to students and residents, is the potential for suicidal ideation, that students may become, or residents may become burnt out enough and then be considering suicide, even if there's not a history of any type of mental health concern. So significant healthcare consequences for the individual, for the community, as well as for society as a whole and our patients. So what does it look like? How could you tell if somebody's experiencing this? So for emotional exhaustion, this would be an individual who's kind of debilitated, who has depleted all of their emotional resources. They may feel incredibly overloaded. They don't have much energy. They're fatigued. They're worn out. They may not really be able to engage in anything, even in traditional conversations, so just random conversations you'd have with someone. Their emotions are just totally exhausted and they're not really able to initiate much. Some of the literature also recognizes irritability as part of the emotional exhaustion, so they're not really able to activate I don't want to call it a normal, a healthy emotional response, and the emotional response may just consistently be irritability or verbal aggression. Depersonalization, that one was my favorite picture. It took me a while to find something that that really emphasized the absolute loss of empathy. So in some cases, it could be seen as an individual becoming more well-versed. So there is a narrative that some of the healthcare professionals should have a degree of cynicism, but this is really taking it to the extreme where there is a complete loss of empathy, where individuals really have a negative response to other people in every single situation. So everything comes across negative, it becomes a problem, there is an issue, and that negativity can spread relatively quickly throughout the rest of the healthcare force. In some cases, individuals will deal with the depersonalization with withdrawal. So everything's a negative interaction and they just don't want to interact with anyone anyways because they never see any of those being positive, which actually increases the amount of depersonalization that the individual experiences. So that could be a withdrawal from coworkers, from their patients, from their peers, from their spouses. So it could be a withdrawal in any aspect of their life. And in the more severe cases, it's a withdrawal in all aspects of their life. The last is reduced personal accomplishment. So this is an individual who feels that they're less competent in their role. They may be having second thoughts. They feel that they're not able to cope. Their overall productivity may begin to diminish. So they don't feel that they're able to do what they're supposed to do, or they're not doing it to the level that they would like. And that really then becomes a self-fulfilling prophecy where their productivity may continue to decrease. In some cases, this may be an individual who's so overwhelmed with what's going on that the first step to any task becomes so monumental, they just don't even know how to get started or where to get started. So how big of a problem is this? I would imagine I saw heads nodding, so I'm going to take that as the impression that you could at least relate with the number of those if you haven't personally experienced some of those. But this actually is a huge, huge problem. We're going to look at one particular study and then some generalized data. So this was a study that was done specifically in medical students that were beginning their second semester of medical school. So essentially the spring semester of M1. It was conducted in just under 300 individuals, and they gave these students 4 different assessments. So the burnout inventory, so alexithymia. I don't know how many of you are familiar with that, but that was my little tidbit of trivia for the dinner table last night because I didn't know what that was. So it's the inability of someone to identify their emotions or express their emotions. So an individual may not even really be able to, as part of the depersonalization, they may not, or emotional exhaustion, they can't even figure out what emotion it is that they're experiencing, much less tell someone what's going on with them and with that emotion. So that's your tidbit of trivia for today if you didn't know that. The perceived stress scale, so how much the individual perceives they're under stress, as well as the functional social support questionnaire. So this gets to some of the depersonalization and the interconnectedness, and it really looks at how functional a person's social support network is. So do I have someone that I could talk to if there's a problem at home? So if the cat's throwing up all over the place, do I have someone I could vent to? Is there somebody that I could go to express concerns about work? Is there somebody I could go to express concerns about pretty much anything, any other thing that's going on in your life, financial stressors or anything like that. So the individuals were given all 4 of these inventories, and what they found was 15% of them met all of the criteria for burnout on the burnout inventory. So 15% out of the 300. 17% met the criteria for emotional exhaustion. 28% met the criteria for depersonalization, and 11% met the criteria for loss of personal accomplishment. I broke those out individually because I think the depersonalization, if you think about reactions to stress, as somebody gets overwhelmed with things, it's suck it up and get it done. So in a way, almost encouraging the loss of empathy and pushing everything else away and becoming a little bit more robotic to just go through the motions to get stuff accomplished. 6% did experience the alexithymia, the perceived stress. So those that were really on the upper end of the perceived stress scale was 26%, so more than 1 in 4. So maybe not all of them were burnt out, but they definitely were able to express that, yes, I feel the stress that's going on. And a similar number had low social support. So that really puts them at risk. So looking at a little bit broader view, there is a huge amount of variability. So that study found that 15% met criteria for burnout. There are a few other studies that looked at medicine students, and the upper end of the estimates is up to 60%. So more than half of the students meet criteria for burnout. It does vary by institution. It also varies by year. So it seems that early in the medical curriculum, so fall of or first term of M1, that level's relatively low. So people are super excited to be in medical school or pharmacy school, and they're ready to go. By the second half of that year, it definitely ticks up, and then you see a spike in M2 and M3 years, and then you see it start to tail off a little bit by M4 once they've got their match and they essentially know what it is that they're going to be doing with the next steps. For residents, so in some cases this is medical residents, in other cases it's just residents in general, because pharmacy can also do residencies. In pooling all of the results, between 15 and 40% have been reported to meet criteria for burnout. It does vary by specialty. So surgery, anesthesia, OB/GYN, and orthopedics had the highest levels. So they were pretty consistently between 30 and 40%. whereas neurology and ophthalmology had the lowest levels. But even the lowest levels were over 10%. So it really does vary by location as well as specialty, but this is by no means not a problem for any of the residents. Your family medicine folks, they fell right in the middle of that range, between 20 and 30%. On the pharmacy side, we do not have as clear data. And actually, one of the reasons Jessica is here is she's interested in doing a project that would give our pharmacy students the burnout inventory so that we can evaluate what the prevalence is for our students that are here. What is concerning is that the mental health estimates are that in pharmacy students, at least 40 to 50% report anxiety and depression, which is double what so that's double what the perceived stress was. So if we have individuals who are reporting anxiety symptoms at double the rate, there is a concern that the burnout may be almost double what some of those other numbers are, which would mean that you're looking at between 30 and maybe 100% in some cases, in some institutions. So is this a learner issue? The answer is no. No, it is not. And one of the things I found most concerning is there are estimates in healthcare professionals. So in substance use disorder, in palliative care, as well as in psychiatry, the estimates go up to 89% of healthcare providers actually meet the criteria for burnout, which means that would be the rule rather the exception out in the workforce, which should be a huge concern. And we want to ensure that we're not fostering that type of unsustainable environment for the learners that are coming through. So just taking a step back, I think it's helpful to see visuals. So on the low end, that means 1 out of every 7 learners has burnout. On the high end, 3 out of every 5 experiences burnout. So it's something you're much more likely to come across if we're paying attention to it. And for your peers, for yourself and your peers, that means more than 4 out of 5 of us are experiencing this. And that's something we should really be taking to heart.
I gotta go.
Yeah, you're done. He's out. Doug's done. So what can we do about it? Recognizing that it really is a significant problem, and those symptoms that have been identified, I think we can all relate to. There's a number of things. So there have been identified some protective factors. So if you have a good working relationship with both your administrator or supervisor and the peers that you work with, that is a hugely protective factor. So if you think about both the personal accomplishment, depersonalization, and emotional exhaustion, all 3 of those areas benefit with a stronger social support, including in the workplace. If there's a way to have the values of the job mirror your personal values, as long as that's relatively clear, that seems to have a protective effect. So if there is a huge emphasis on numbers and general productivity, that may be really problematic, but working with administration to see if there's a way that that could be reframed so that the values are clear that this is really in the best interest of the patient, that we're trying to increase access maybe, as opposed to hitting the numbers for productivity. And the impression or ability to have a degree of control. So with students and residents, there is a hierarchical relationship. There will be, it's supposed to be that way. But is there a way to allow them to have some degree of control? So you have to do a journal club presentation. You get to pick the article, and you can pick the day, and I can give you a couple options. So is there a way to have them be a more active proponent as opposed to this is what you're doing and I'm controlling every aspect of your life for the next 4 to 6 weeks? So those are all protective factors. If you're looking, I love the demotivational, and Dr. Paxos was here earlier, so he and I, as things get stressful, we're in the neuropsych block, this is what we send back and forth to each other. So if individuals are looking for a way to really be motivated and be inspired, if you look at a lot of the motivational, inspiring things out there, it's essentially try harder, do more, suck it up,
break the space-time continuum to be in two places at once.
Essentially, like find a way to do it all. And that's really not, that's not realistic. And it is something that we need to continue to challenge. So on a different level, I want you to change your perspective. Take a step back to think about, hey, you get to do this. It was your life mission to be a healthcare provider. You're at the end of your training. You're out on rotation. You're making a difference in patients' lives. So yes, there's a whole list of things, but you get to do this. And just changing that frame from a I have to a I get to can make a gigantic difference. Other things related to that are really being proactive, watching for this, not waiting until they're having an absolute meltdown. I have puffs in my office for a reason, because that's when oftentimes students will come forward with an issue, is when it's gotten to the point that they can no longer handle it. These are all high-functioning, incredibly intelligent individuals. So when it gets to that critical point, it's already way out of control. We need to be catching this as we see some of those symptoms coming forward. And the best way to do that really is to be encouraging a healthy lifestyle. So encouraging good sleep habits, adequate nutrition, regular physical activity. If there's a way to do walking rounds, if there's a way to even, hey, let's go outside for 10 minutes around lunchtime, just so we get outside, even if it's freezing cold, for a change of pace, a change of scenery. And also modeling. So modeling that work-life balance as best as you can. Yes, there are going to be limitations. There are a lot of demands put on people, but the more that you can create that safe space, that particular balance that can be sustainable, that's what the students and the residents are more likely to emulate. We've not done a good job, as evidenced by the estimates of up to 90% of us qualify for burnout. So it's really important that we start looking at this, because not only are we hurting ourselves, we could be unintentionally hurting our patients. So what are other things that we can do? So there are different levels of intervention on an organizational level. Is there a way to evaluate the work pattern? So if there's a student or a resident that has young children at home, maybe it's really difficult for them to get there at 6:45 to do pre-rounding. Okay, is there a way to maybe evaluate some of the patients and do some pre-rounding prep stuff at the end of the day, because they have more flexibility in the afternoon or early evening to be able to do that? Is there a way to maybe break it up to be a little bit more flexible with the schedule? Take breaks. As much as the initiative tends to be, hey, power through, suck it up, the harder the better, sometimes it's really important to just take a break. If there's been a difficult patient, if it's been a rough morning, things just aren't going well, it's okay to be like, you know what? Hey, why don't you take 5 minutes? Go get a cup of coffee, go outside and, take some deep breaths, just take a break to get away, because when you come back, you're much more likely to be more productive and more efficient and effective. The other thing is to balance work with life. So encourage some type of a hobby. So the hobby could be allowing for 15 minutes of YouTube or social media or something. I went to an institute that was focused on student mental health and well-being in the fall, and they had us take the burnout inventory. 3/4 of us who were dedicated to improving our students' mental health met the criteria for burnout, and one of the biggest areas was no one had outside hobbies. It was all work all the time. It's really important to be able to enrich what you're doing with work with something else. And if it is just the social media, giving individuals the space to have 15 or 20 minutes, enjoy it. You don't have to feel guilty that you're not doing something else. Do that, and then you can come back to whatever other responsibilities you have.
Are you okay, Dr. Ballister?
Yeah, I'm okay. It's
on the work group side of things, so like looking at peers, encouraging clear communication. So making sure that it's not, hey, you're on your own, you have to be the Lone Ranger, do it yourself, start from ground one, you don't have to recreate the wheel every time. And there is something to be said for working in a team. So ensuring that there is clear communication. Yes, we need you to prepare for all of these things. Here's what would be helpful and that you need to do from the education standpoint or in preparation for the care of the patients. But what could be done by the medical assistant that doesn't then have to be duplicated by someone else? Developing good coping skills. So don't let the learner avoid conflict resolution. So they don't get along with the nurse that's there. Okay, brainstorm what you should do and then have a discussion and I don't want to say force them, encourage them to be an active participant in it. Having that conflict resolution may actually give them a much better working relationship with those individuals. And chances are, regardless of where they go end up working, there's going to be somebody that they don't get along with there. So it would be a great time to practice and have it be role modeled for them.
And conflict isn't bad. Disagreement is an opportunity to come out to a whole new place.
Absolutely. Encouraging the establishment of social support. So making sure that individuals are establishing community, that you're not eating at your desk trying to do something by yourself every day for lunch. Maybe it's just once a week. Once a week for 15 or 20 minutes, you do go somewhere else and have lunch and have an work-related conversation. But encourage that social support both within the workplace as well as outside. On the individual level, encouraging the development of coping skills. So cognitive restructuring. I am a mom of two. I work full time. Recognizing that you do not have to be the PTA president, the leader of every single thing, the room mom, as well as doing absolutely everything and all of the extracurricular things at home. Like really establishing realistic expectations for what you're able to do. And then realistic time management. So if individuals are plotting out their day, expecting to be doing work for 18 hours every single day with absolutely no breaks, that's not realistic. So what is a way to break up that time management so they're not putting themselves in a position that's essentially going to be unsustainable? Emphasizing things like mindfulness and self-understanding so that they're able to identify when they start having problems way before it gets to the tipping point. So before they blow up at an individual at the workplace, they need to recognize, hey, I'm way overwhelmed and I'm not even sure what I need to do next. Or there are all of these unrealistic deadlines, who can I have to help me? So that they're able to mobilize that and not feeling quite so helpless. And then utilizing relaxation strategies together. So whether it's deep breathing exercises or a quick visualization, there may have been a very difficult patient or situation that just happened. Let them see what your relaxation or coping strategy is, to take a minute and be like, wow, that was a tough one. Okay, we're gonna take a deep breath, kind of think about something else, maybe go get a cup of coffee, and now we're gonna go back and go back into the next room to see the next patient with a fresh perspective, as opposed to, yeah, that was really awful, we just keep going and we're not even gonna process it. So it is incredibly common, burnout, not only in our students, also in our residents and fellows, and in our fellow healthcare professionals. The three areas to be watching for are emotional exhaustion, depersonalization, and lack of personal accomplishment. And really, it's non-pharmacologic. It is encouraging some of those healthy lifestyle things, recognizing there are limits, recognizing it may be very challenging to continue to juggle things, but there is a way to do it successfully without putting yourself at jeopardy and really stretching yourself way too thin. So instead of saying, hey, it's pitch black, there's no way out, you just have to get all of this done, is there a way to step back and say, you know what? Yeah, it's dark, but maybe we'll be able to see the stars. Maybe we can really change the overall dynamic so that not everybody's super stressed out. So that